With Africa World Hour here on Channel Africa, the African perspective. And for our 2140 feature today, we talk about something that has been considered, labeled, in fact, controversial in some sections of society. But we look at it from the prism of what is World Mental Health Day tomorrow. So we thought we'd take the conversation in a different direction, but it's within this realm. And we look at conversations around gender, health, and human rights, how they're evolving. But in many spaces, access to sexual and reproductive health services and gender affirming care still face stigma, misinformation, and of course, policy gaps. So, tonight, we speak to a mother, a former health professional whose journey alongside her non-binary child offers a window into what it really means to love, to listen, and to advocate in a society still learning to understand gender diversity. So from navigating family conversations to confronting medical and social systems not yet fully equipped for inclusivity, her story helps us to unpack what gender-affirming healthcare really looks like, not in theory but in practice. We're joined now by Dr. Marion Stevens, a leading voice in sexual and reproductive justice and a former member of the World Health Organization's Gender Advisory Panel. Dr. Stevens, a very good evening to you, and thank you so much for allowing us to speak to you. I'd like to start with your story as a mother. When you first began to understand that your child identified outside of the traditional gender binary, and what emotions or thought that evoked for you and for your child?
Well, good evening, Tsepiso and your team, and thank you for inviting me and for um, having a conversation on these issues. So, um, the way I really perform gender myself is not very typical, stereotypical, and I was the kind of person that got married by surprise and then had children by surprise and wasn't too sure what you do at kitchen teas and at baby showers. And um, so when we had our children, I had a lens of kind of seeing and knowing that gender was a bit of a performance about how boys are supposed to be or how girls are supposed to be. So my children both had um, kind of blondish textured curly hair and um I was the kind of person that when people gave me gifts, I said, please don't give me pastels. I don't like pastels. Can you give me like, bright colors? And so I started to observe people's reaction to my choices. And so um, I was like getting questions like, what is your child? Is your child before they were even conscious of it? And then I started to see them being pleased. And I guess it was how we are as a family. I didn't see my child as so separate from me in those early days. And I got very concerned about how my child was being pleased in what they were supposed to play with, what colors they were supposed to wear. And so, for example, one time my partner came back from a trip in London and there'd been a sale at Gap and um, they'd brought like a pinkish cerise shirt. And so our child went off to preschool with the shirt because they loved the color and because we bought it. And then they came home and the teacher actually said to us, why is your child wearing that shirt? And then the teacher started to say, like, what are you doing with your child's hair? Like, so I realized that gender as a parent was going to be a long journey, even before my child, my youngest child, started to explore a gender that was not the gender
Hmm.
that they were assigned at birth.
So the fact that you're a nonconformist in terms of what society expects of you and how to express that, do you believe that's what helped your child to express their thoughts, their feelings about their being non binary? And I know it's a subject of conversation, and even to the other extreme, I'm
Mm.
seeing it on social media, the cancel Netflix culture.
Yeah.
because of what people are saying. It's being too open that makes children think it's okay.
Mm. So, I think that we come from a very particular history in South Africa where we have been socialized to read race and gender in a way that comes with enormous amount of pain and reflection. And so um, I am curiously aware of the import that has happened because of these contestations in the global north. And it's unfortunate that they've landed in South Africa in this way because I don't believe that we had these kinds of concerns and contradictions, in our early days. For example, gender affirming healthcare was performed in the 70s in South Africa with nobody batting an eyelid. There's a very famous, actually, Republican model that lives in Texas who is like almost in her 80s that was operated on in South Africa in Durban before they left. So it's a very strange thing. And the other thing that is quite clear is that in, pre-colonial societies, um, within our region, the historians tell us that gender was a continuum and it was not policed. And for many people who have had the calling, there were also ways of expressing their gender through their calling and their practices, their cultural practices that
I,
were normalized.
I'm so glad that you referred to, your own professional history, particularly within South Africa. And you would have studied apartheid era conditions before and post democracy around medical anthropology. So, the South African Human Rights Commission recently emphasizing the constitutional right to dignity and access to gender affirming healthcare. Have there been any notable changes, and particularly given the fact that South Africa went through institutionalized discrimination?
Well, absolutely. And you know that, one of the very painful paths that we have in South Africa is that the military actually weaponized issues of gender and sexual orientation. And, we're very conscious of what's happening with the genocide in Palestine at the moment. And I think they kind of practice those techniques of terror and torture in South Africa. Both had significant years in 1948. And we started with, I mean, we still have a man that's walking around in our cities, in our shopping malls called Vote who practiced all kinds of very concerning methods, exploring remote control fertility vaccines to conversion therapy. And that, as a health provider who trained in the 80s, early 80s, that's something that I saw. I trained at a regional hospital in the Western Cape in Wynberg, and I have a stark memory. I trained when I was quite young. At 17, seeing somebody that had escaped from Wynberg Military Hospital with a botched gender sex assignment. And clearly, this person was being experimented upon. And it left a lasting impression on me in terms of that the military was just nuts. What on earth were they doing experimenting with surgeries on this person? Um, and so this is our legacy and history where we come from a place, a very dark place. And to have the Human Rights Commission take these issues on under the leadership of Chris Nissen, um, who is deeply committed to issues of non-discrimination and human rights, where we're starting to see leadership in policy statements on legal recognition, on access to education, and on safety and security, and then on healthcare. So these are
Mm.
really important public spaces where um, transitioning can start happening. It's not only within, a health clinic that gender affirming healthcare takes place. It's actually in a wider context.
So fast forward to now, your child, and especially when you're talking about spatial rights, I'm curious how conversations that have become misinformation, particularly around gender
Mm,
identity, gender diversity, have translated in the environment we're in now. You're also speaking, and I'm thinking about it, the differences between a township and suburbs, how that also impacts on a child who makes the choice that they're
mm,
expressing themselves as non-binary.
mm. So indeed, I mean, the experiences of gender diverse and transgender children and individuals, in South Africa are as different as we all are in our different spaces. And speaking from my experience, from, observing and understanding colleagues, and also from my own child, um, we unfortunately have had this imposition of concern and disinformation from the global north, and it's been catapulted in, Trump's first executive order that he signed on the 25th of January. And I looked this up because I'm writing something at the moment. It was the first one that he signed was a denial of transgender identities and referring to gender as an ideology. Now, how does this land in South Africa where we have a completely different approach, even amongst all of our differences in how we view each other and we see each other as human beings and humanize each other? And so, um, you know, some of the concerns and complexities that are imported are just quite bizarre. The global north is concerned about toilets and bathrooms and safety of bathrooms. Well, we've got a water and sanitation issue. And please, can we just all have toilets in schools, full stop? So you can't just kind of translate these issues from the north to the south. We have very, very different contexts. The issues around, school uniforms. Well, we know that there's a monopoly on school uniforms and school uniforms are very expensive. And so we just need children to be able to access and be warm and comfortable, and to be able to have desks in schools. The kinds of issues that are of concern um, are really, quite, they're not really issues in South Africa. Um, what has become imported, which is very, very concerning, is resistance to comprehensive sexuality education, which we know in South Africa covers a whole continuum of issues around, um, you know, being able to name emotions and feelings, talk about your body parts, know the different parts of your body. So if you are under threat, you can actually be specific when you can say something or something to a health provider or to an adult if you need care. And then at a later stage, talking about contraception or issues of sexual and reproductive health. But comprehensive sexuality education is being framed by the kind of global evangelical churches and then importing into our churches that it's about gender
Mm.
ideology and it's taking parents' rights away. And, so I think it's really important to listen very closely to how we are being influenced. And
And
in
how we
many ways,
frame these issues. Dr. Stevens,
yeah.
I need to, as a final question,
Yeah.
because you are talking about it, especially from a global perspective, you were on the WHO's gender panel, and I'm thinking about support mechanisms. The type of insight that you were able to give to them as a medical health professional, when you speak
Mm.
about how, you know, this is extended to help those with gender identity considerations. When you and I spoke at some point, we spoke about pubic blockers, and I'm just wondering how those interventions are understood and are practically implemented, and most
Yeah.
importantly, the impact of mental health as well.
Yeah. So within South Africa, I'm going to talk about what's happening here. Um, when young people explore transitioning from, pre-puberty, the kinds of interventions that are happening are really about supporting their mental health. And that's what happened with me is, excuse me, we made sure that we reached out to health professionals who could support me and my partner and my child and my family in how to come alongside them and assist them in a very hostile environment where there's stigma, discrimination, labeling. Children come to school and they're very cruel and they don't know, aren't given language, they don't understand. And so then, you need to doubly equip your children to be able to understand what's going on and to protect themselves. So the first line of transitioning really is about a social support, and there's so many NGOs and organizations that folks should really reach out to, parent groups, in understanding this. We're not really talking about puberty blockers anymore. I've been unschooled and relearned that we're talking about them as puberty pauses, because these generally happen when a adolescent reaches puberty, um, and very few children actually end up accessing this. But if it is indicated after thorough workup with the family, the child, possibly even and the range of different health providers, whether it's an endocrinologist or the GP or the psychiatrist, they will then be given this hormone. And what I want to emphasize is this is not a strange new treatment. We've been using puberty blockers or puberty pauses, and I want to emphasize this is entirely reversible. You can stop it, and your puberty will then start. If you have a reproductive cancer, or if you've got a condition called precocious puberty, and so that is what you would have. And this is very valuable for, um, adolescents who are starting to get those rapid changes that would be devastating. So, for
Mm.
example, for a young trans girl, if their voice starts going deeper, if they're getting facial hair, if they get their Adam's apple, you want to kind of prevent that from making them feel completely dislocated from their body and hating the changes. So just to pause and to wait. And then at a later stage, after an assessment, they will then be provided with
Okay.
hormones. But this only really happens at a much later stage.
Dr.
So I think a
Marion.
lot of the concern
Hmm.
is quite misplaced because this is a very well considered, safe treatment.
Dr. Stevens, thank you so much. I think this deserves so much a lengthier conversation, and perhaps with several other participants as well, but a very important subject, and we really do value your insights. Much, much appreciated.